Good morning students. Today I will be going to teach you chapter 2 of civics, that is role of government in health. So let's have a look on the collage which shows us different phases of a country. So in democracy people expect several things from the government for the welfare work, and this is a way how government help people as they provide several facilities to the citizen of a country, like housing facilities, better health facilities, food, and so on. So what is health? Health in simple terms, if I talk about, health is the state of being free from illness and injuries. So right to health is one of the fundamental right, but with unfair and unequal provision. That means we have right to health, and it means that each and every individual of a country has right to get all the health facilities. But somehow in our country the provision of health care is not up to the level which actually it should be. So in recent years the concept of health has changed. It has moved to the concept of fitness to the concept of wellness. This comes under National Ayush Mission. So the next topic is healthcare in India. See, India is one of the largest nation in the world to have highest number of medical colleges and highest number of doctors globally, as pharmaceutical industry is the third largest in volume and 14th largest in value. This is one of the most positive points of healthcare in India. Healthcare facilities can provide the care and services that the patient needs. To run these facilities, we need health workers, nurses, qualified doctors, and other health professionals. So India has large number of hospitals as well as clinics with good doctors. Next is two types of healthcare facility we have in India. One is public healthcare facility and another one is private healthcare facility. So the first is public healthcare facilities. Public healthcare services are that services which are run by the government of a country, or you can say that these are known as government hospitals. The basic thing would be it is available even to the smallest or remote areas. So even in extreme villages they have PHC means primary health centers, where they can or patients can get a basic recommendation. This services extend to each and every corner of the country, starting from rural areas to the urban areas. But the main problem arises, do all individuals are getting proper treatment in public hospitals? No. The main problem is that they do not have adequate facilities and equipments by which they can be treated. So this is the basic issue faced by the healthcare in public hospitals. As to exemplify, a person named Hakim Sheikh who fall accidentally from a running train and suffered from severe injuries. Afterwards, he was taken to the several government hospitals, but they refused him that they had lack of beds in their hospitals. Moreover, he had no money to pay in private hospital, but he was in critical condition that he has to be taken to the private hospital. After treatment, he has to pay the bill to the in the private hospital, but he do not have much money to pay that dues. After that, for paying that dues, he had sold his farmland to pay his bills. This shows that the condition of public hospitals or government hospitals which are not up to the mark, that the poor can be treated in these hospitals. So the next is private health services. See, there is a wide range of private health facilities in our country. In suburb, private sector hospital provide most of the facility, and these hospitals are owned by individual or community, but these are not controlled by the government as the public hospitals are governed. In these hospitals, all facilities and equipments being provided by them, but the main problem arises that we have to pay a lot of money for every service that we use in private hospitals, and only 40% of people in our country can have access to the private hospitals because they are too expensive for all to get services in the private hospital. Here the question arises, is adequate health facilities is available to all? Do all citizens are getting equal health facilities in India? No. Public facilities are still at the same pace. Still people have an access to private hospitals. This is happening just due to surge in the price of health treatment, and due to which sometimes many people, poor people actually died because they could not afford medicine to cure their diseases. The basic problem is only 40% can afford private hospitals when they are ill. So, what can be done to cure these problems and to bring equality among public and private hospitals? First and the foremost is government should take a responsibility to provide quality healthcare services to all the citizens, especially the poor and the disadvantaged. And government should work on public health facilities as well as their basic amenities, which helps them to improve their health situation of all the people. So here I am going to give you an example. Major example was from Kerala, that is in 2011. Kerala gave 40% of budget to panchayat, that is for water, food, development and education. And panchayat are independent to manage their budget, and in present scenario the rural area changes much faster, as well as the public health care facility has taken a new look. As you can see in the first image, the public hospital in 2011, and in the second image you can see the condition of the hospital in the present scenario. This shows how the government is trying to bring change in the government hospitals. The best example in present scenario is COVID-19, as this shows that how the government is trying to bring change in the public hospitals, as they are providing all the facilities to each and every healthcare centers. As you can see in the picture 1 as well as in the picture 2, how the government facilitate all the public hospitals, as they can treat all the patients wisely. So series of measures have been taken by the government of India to brought up some changes in health services. So government alone cannot do everything. Being a responsible citizen of a country, we should also support them in every phase. Thank you. I hope you like this module.